Hi everyone, thank you for joining today's meeting on Facebook Live in relation to World Patient Safety Day. My name is Richard and I'm head of patient safety at Addenbrooke's Hospital, and we're really pleased to be able to join everyone on World Patient Safety Day. This year's theme is looking at maternal and newborn safety, which is obviously a really important thing in terms of the hospital and the improvement work that's going on at the moment. So in terms of World Patient Safety Day this year, the World Health Organization has got a few objectives in relation to that. The first one is to raise global awareness on issues of maternal and newborn safety, to engage multiple stakeholders and adopt effective and innovative strategies, call for urgent and sustainable actions by all stakeholders to scale up efforts, and advocate the adoption of best practice at the point of care to prevent avoidable risks. And I'm sure we'll all agree, really important objectives in terms of patient safety. I've been joined by colleagues within the organisation today who are working on and have worked on some work streams in maternity safety, and we're just going to do a bit of introduction about what's been going on. So I'll just go around the screen and let people introduce themselves. So Kimberly, I'll let you go first.
Hi, my name's Kimberly Skinner. I'm the lead midwife in maternity services for quality and for patient experience, but part of my remit is looking at quality improvement, regional working, and quality assurance and improvement in relation to maternal and newborn health.
Okay, thank you. And Jenny.
Hi, my name's Jenny Rollerton. I am clinical lead in patient safety. I am also a practicing midwife, so I sit in both camps, and I'm really excited about World Patient Safety Day on Friday and also what we can showcase of what we're doing in the Rosie. It's been a really tough 18 months to 2 years. We want just to reassure you what we've been doing in the background and how safe we are here at the Rosie.
Thank you. And Carla.
Yeah, my name's Carla Evans. I am Trust Risk and Corporate Quality Manager now. I'm also a neonatal nurse, and I'm here today to talk about some project work that I've done in my capacity as NICU nurse at the Rosie over the last year.
Perfect, that's great. Well, thanks everyone for joining. As we said, we just want to give a quick kind of overview on some of the work that has been going on. So it's probably best just hand over to Kimberly first, just to talk around some of the key work streams that have been going on in maternity. And then later during the week and during the day, there'll be some more videos on some more detail and how to find out more about them.
Great. So just as a brief introduction, so maternity has really been on the safety agenda and the quality agenda for the last few years since the launch of the Maternity Transformation Programme. And for those of you who don't know what the Maternity Transformation Programme is, it came from Jeremy Hunt's national ambition to reduce stillbirths by 50% by the year 2020, and then by 2025, and then they reduced that back down to 2020 because we were doing so well. So what's really reassuring as the offset is we have already in our hospital in the Rosie and in CUH reduced our stillbirth rate by 50% already. So we are looking at ways that we can sustain that change and ways that we can achieve the other arms of the Maternity Transformation Programme. So we have lots of work going on in my remit and in the safety and quality team and the rest of the Rosie remit on implementing the Saving Babies' Lives Care Bundle. And that's a care bundle of it's a set of initiatives that if we implement all of them together as a bundle, that is evidenced to improve outcomes in prevention of stillbirths. We're looking at Meow's implementation trust-wide, which I'm sure Jenny will talk about in a little while. We've got lots of digital improvements going on, and we've got lots of work going on in terms of team working and multidisciplinary team working and involving service users and co-producing our services going forward, because to be a really safe service, it has to be personalised. And I'm sure you'll hear today and tomorrow from our service user advocacy group, the Maternity Voice Partnership.
Perfect. That's great, Kimberly. It's really good to hear about all those work streams that are going on and underpinning all those elements of patient safety. So Carla, I know you were working on a particular work stream. I just wondered if you wanted just to introduce that and some of the great work that's been going on there.
Yeah, well, as Kimberly introduced, I was working under the Better Births remit, the whole of the Maternity Transformation Project. The vision is to deliver safe, more personalised care for all women and every baby, but also one that improves outcomes and reduces inequality for everybody as well. And we know that babies who are born prematurely have much better outcomes when they can be born at and cared for in a hospital that's got what is known as a tertiary neonatal intensive care unit. Addenbrooke's does have one of those. as do many other hospitals in the country, but specifically in the East of England region, we have been working hard to try and establish new policies and new procedures which will ensure that any baby who is born at the under 27-week mark is offered and accepts a place in a level 3 centre. And the organisational complexities of achieving that is not to be underestimated. It's potentially absolutely huge, but it's very possible, and it's where we are hoping to head towards and where we want to achieve that as an outcome. So all of the babies that need to be born in a level 3 hospital are, and likewise babies who don't need to be born in a level 3 hospital but can be born in a what we call a level 2 hospital, or even a midwife-led birth centre or at home, so that every family, every mother, every baby combination has the birth that is personalised and right and best for them, but is also safe and delivers equality of outcomes. So that's a really exciting project which will massively improve patient safety and continue to contribute towards the target of reducing inequalities for all. Very briefly, another piece of work that we've done on patient safety at Rosie over the last few years, but a bit more concentrated in the last year, is about keeping mother and babies together after they're born, because we know that that's a really important relationship, and babies and mothers and families all have a better outcome if they're together. One of the reasons why babies sometimes have to be placed into the neonatal intensive care unit after birth is if they are not kept at the right temperature after birth. And this can trigger off a sequence of other events which can need more medicalised intervention. It's, in theory, quite a simple thing to correct, is to keep the baby at the right temperature, which is why we focused on it. We've introduced loads of really lovely, cozy initiatives to try and keep our babies at the right temperature. Lots of training, lots of engagement with parents and our maternity neonatal voices colleagues to really try and get this service shaped that ensures that babies and parents are kept together, they're kept healthy, and ultimately the outcomes are improved for everybody. So they're just two pieces of work that we've been looking at over the last year, which links in with patient safety.
And you might have heard from Sue Broster last week in the 827 talking about the Panda service, and they are absolutely instrumental in helping to transfer these mums and babies around the region to ensure that those babies are born in the right place.
Absolutely, yeah, really like the linchpin, if you like, for the whole service.
Thank you for sharing those work streams with us. And Jenny, I know you've been working on some, obviously in the patient safety world as well, but having that clinical background as well, some important work streams. Is there, did you want to just go through those kind of highlight points?
Sure. So as I said, I work in patient safety. I'm also a midwife. I've been working with Kimberly regarding the implementation of meows in ED. What does that mean? So the NHS implemented the National Early Warning System several years ago, and it is the parameters you look at are blood pressure, heart rate, temperature, and respiration, and it gives you a scoring. And depending on that scoring is how you escalate a patient. And in the ED, there are nurses and there are doctors, but there aren't midwives or obstetricians. So what we're trying to do at the moment is get everybody together and start talking about when a pregnant woman actually comes to the ED, that her parameters are different. She responds differently to a blood pressure, and implications on her and her baby are quite significant. So currently we're getting everybody together. We're trying to install meows in the ED. It's already in maternity systems, it's already in gynae, but actually bringing it into the ED so our patients are kept safe and correctly escalated, and the outcomes are much better, will be much better for mother and baby. So that's something that we're really excited about, and that's coming very shortly.
That's great. Thanks, Jenny. So hopefully what we'll do in some more videos that we're putting out across Facebook is going to some of these work streams in more detail, but I think it just shows the amount of great work that's going on in maternity services around patient safety and all those different aspects of improvement. So if anyone has any questions on those, please feel free to email us, drop us a line. Very happy to hear feedback on what's going on and what we can do differently. Perfect. Thank you very much, everyone.